This should be the simplest shoulder socket modification you will have ever done. If you took a great cast, almost all you will need to do is smooth the cast. Since you will have already marked the socket trim lines and alignment lines on the cast itself while still on the patient, you should know the proper orientation. Modifying the socket in the incorrect orientation will slightly change the fit, so make sure that when you pour your cast, pour it on the correct alignment lines. The only areas of the cast that we need to modify are that which is within our trim lines. Begin by simply smoothing the cast within these trim line areas. Take off any high spots that may have occurred from roping in the plaster. There's a lot of forgiveness with this socket modification. All we really need to end up with is the surface contouring. Any weight-bearing areas are going to be within the fabric, not the stabilizing unit frame. Practically, the patient will be able to gain or lose a considerable amount of weight, and the stabilizing unit should still fit. I like to give a very slight concave shape to the stabilizing unit if the patient is overweight. This will help prevent the frame from ever having an edge pressure against their skin. The fabric will cover the edges of the frame sections, which inherently will cushion any edge pressures, but a little concave recurve can be helpful just in case. This socket design does not need to have any aggressive modification in the deltoid pectoral groove or supraspinatus areas, but I do like to make sure that those areas are at least defined in the cast and modification. By doing so, it will help make the socket more streamlined to the user and will help maintain orientation more effectively around the user's body. Most of our modification is already done. Now let's just smooth the cast within our trimline areas, and then we'll move on to the shoulder joint attachment area. We mark the correct position for the shoulder joint in our cast. Make sure that if you do a build-up, that it has the correct orientation of tilt that you desire for the shoulder joint to have in the final socket. There are several available shoulder joints, so refer to the manufacturer's recommended alignment. In general, though, this alignment of the final attachment position will likely have a slight anterior tilt and may have a slight posterior tilt as well. So be sure that the orientation of the shoulder attachment area is modified in the correct orientation. If the patient has a true shoulder dysarticulation level amputation, you do not necessarily need to actually do a build-up, as you may want to keep the shoulder joint as close to the body as possible. This gentleman has a 4/4 level amputation, so we need a build-up to place the shoulder joint in a more anatomically correct position. Now connect the distal aspect of the shoulder joint attachment build-up to the distal lateral aspect of the frame. This vertical strut that runs between the two will eliminate any vertical flex at the shoulder attachment area and allow you to have a considerably lighter lamination. And finally, just smooth up the rest of the cast, and that's it. You're done modifying.